So Lou, when someone comes into your office, like what would be happening that would make you suspect that there was heart valve disease?
So there's a couple of things. The first thing is if they're having symptoms, and the symptoms for heart valve disease are very similar to what people think about with heart attack symptoms or blockages in their arteries, because you have the valve that's causing a problem with the arteries to the heart getting a blood supply because it's so stenotic. So you can get chest pain, chest burning, shortness of breath. But what also happens with them is they can become syncopal or pre-syncopal, which is a fancy term for they pass out, especially if they exert themselves. Of course, that valve, as Dr. Ahmed said, it gets so tight that if you exert yourself, there's not enough coming out to get to your brain and you can pass out. So that exertional syncope or passing out is another symptom. We also pick it up on the examination where you'll listen to the heart and you can hear these murmurs, and and Dr. Ahmed knows, you go through med school, you painstakingly learn about all these different types of murmurs and what they mean. Those are helpful, but a lot of this disease you may not hear on an examination because we base a lot of our education about those type of murmurs on rheumatic fever, which we don't see a lot of.
Yeah.
A lot of it now is just as Dr. Ahmed said, it's aging, and they don't sound quite the same. Very often we pick it up by accident. The patient has a stress echo or they have an echocardiogram done for another reason, and they find that they have aortic valve or other valvular disease in that way. So symptoms, you hear it on exam, or you find it by accident.